And we're on. Hi, Dr. Patel. Thank you so much for meeting with us today. How are you?
I'm great. How are you?
I'm doing fabulous. Looking forward to Christmas. Are you guys going to have a big family Christmas this year?
We'll be in Michigan at my husband's family's home with all his siblings.
Oh,
It'll be great.
yes. So you're shopping for all the winter clothes, I'm guessing right now.
Already done. Black Friday deals were taken.
Nice. Good for you. You're on the ball. Better than me.
Well,
Well,
you're ahead with the 2-year-old.
oh, yes, that's true. Well, I'm going to go ahead and introduce you so that our audience knows about you. Dr. Yoshita Patel she owns and she is the head doctor at Viera Pediatric Dentistry. And your practice has been open for a little over a year, correct?
Yep, just a year and a month.
Awesome. So she is our go-to girl for all things oral health. And especially when it comes to our children, because if we don't start them out right from the get-go, then we have trouble later on, right?
Absolutely.
So as moms, we have to get the education and the knowledge so that we can protect our little ones' mouths so that they have healthy teeth for a lifetime. So I have a few questions that we're going to get started with. And the first one, I just want to know a little bit about infant health, infant oral health, because some doctors will say, okay, make sure you wipe the gums after each feeding, and then other doctors say, oh, you don't need to do that. So I'd like to hear your professional opinion on that.
Sure. So you want to start cleaning the gums and the teeth as soon as baby's born. It helps prevent against things like fungal infections and things like that when the milk gets stuck on there, and it also helps prevent against cavities long term. And so what you want to make sure you do is at the very beginning, just to get them used to having a hand or a finger in their mouth, you want to use a wet washcloth and just clean the gums as frequently as possible. Obviously not after every feed because you're feeding them every 2 hours.
Right.
But especially, when they wake up in the morning after that first feed, and then also after that last feed before nighttime is a great time to get them used to that morning and night routine that we aim for when they're a little bit older. As soon as the teeth come in is when I recommend starting to brush with a regular child-sized toothbrush. And I do recommend the use of just about a grain of rice size of fluoride toothpaste. That surprises a lot of parents because the tube says do not use under 2 years old. That recommendation is based more out of margin of safety than the actual use of the toothpaste. And so as long as the parent is in control of the amount used on a toothbrush, it's absolutely okay and it's beneficial to use a grain of rice size of fluoride toothpaste as soon as the teeth pop through. And that can be as early as 6 months or as late as 15 to 18 months. That varies depending on the child. So by creating that routine, it's going to help prevent against cavities long term. And there are a lot of studies that show that if we can keep a child cavity free up until age 3, they won't have cavities for their entire lifetime.
Okay.
We want to start really early. Once the child's able to spit, which is usually around age 3 or 4, that's when you can increase the amount of toothpaste to about a pea-sized amount. And that amount will help prevent against cavities. It's also incorporated into the developing teeth between ages 0 and 10. And so that's why we also discuss, you drinking tap water that has fluoride in it, things like that, which we'll get into later. But until the child is about 7 or 8, we recommend that the parents brush for the child, because you can imagine dexterity is not something that kids have a lot of, and that develops over time. For some kids, they're able to write their names really clearly by age 6 or 7, and others it's 10 or 12. And that's the same pen that they're using to brush their teeth. That's kind of how I base my recommendations is, are they able to write really clearly, and are we seeing plaque at each visit? And if so, mom and dad need to step in and do that for the child. As far as flossing is concerned, as soon as the teeth are touching is when I recommend flossing. For my son, he had teeth at 10 months and they came in touching. And so we started flossing his teeth at 10 months old. A lot of kids have gaps between their teeth, so you don't need to really floss, but it's always good to get into that habit early so they're not flossing when they're 4 and 5. You can start a lot younger. And then as far as breast milk and formula, both can cause cavities over time. And so breast milk in itself does not cause cavities. It's very protective, and it's great. It's a great way to feed our children for year 1, 2, 3, as long as you would like to have that relationship with the child. The concern I have as a pediatric dentist is breast milk mixed with food is what's going to lead to cavities.
Okay.
And so the breast milk is used by bacteria to create cavities when mixed with a carbohydrate. So you can imagine, you know, as our 6-month-olds are starting to get into that solid phase, they're eating those little crackers and Cheerios and things that are easy to digest, but not easy to brush off the teeth. And so you can imagine eating those snacks throughout the day frequently, you're breastfeeding throughout the day frequently, and then at nighttime we're continuing your breastfeed. Now, if those carbohydrates aren't removed from the teeth, bacteria is going to use the breast milk and the carbohydrate as a substrate to create cavities. So that's why we see cavities at 12 and 18 months because of that inability to brush the teeth afterwards. Formula in itself has more carbohydrates, and it does lead to more cavities. So that's why we always recommend no bottles in bed at night. You don't want to start that habit. If the bottle is given at night, you always want to brush or wipe the teeth off afterwards to ensure that they don't coat the teeth overnight as well. A lot of people don't know that our saliva decreases in flow rate overnight. And so of the washing and cleaning throughout the day that we get from sipping on water. And so you're talking about leaving those sticky carbohydrates on the teeth and not getting them washed off throughout the night. And that's when our cavities start to form even more.
So much good information. And I hadn't even thought about the connection between the handwriting and the dexterity to brush teeth. And I see that in my own kids too. And, you know, the one who struggles with handwriting is also the one who struggles with plaque buildup, interestingly. So that's an interesting connection that I never thought of.
Well, and that's why the advent of electric toothbrushes is kind of nice, because it takes that out of the equation. And so for the kids who are trying to be more independent and can be more independent, I always recommend, if they are having trouble with that dexterity, switch to an electric toothbrush, because then they hold it against the tooth, excuse me, and just allow the toothbrush to do the job instead of having to do those little circles that we attempt to do with our hand.
Okay. And does it have to be a fancy toothbrush, or can it be like one of those little $5 electric toothbrushes?
I always suggest starting with the $5 one and seeing how it goes. Some kids with sensory issues may have difficulty with the vibration or the sounds and things like that. So you don't want to splurge and spend a lot of money on something they're not going to use. So
right.
Young, I always say start slow, see if they enjoy it, and if they do, then spend a little bit more money and get something that's going to last you a long time.
Okay.
What you want to look for is a smaller brush head, so usually a little round head is what you want, and one that's oscillate. A lot of the battery operated ones just vibrate, and that's really not going to do a lot. You want that oscillating feature so that when you hold it on the tooth, it's scrubbing it, just like when you're washing a dish, you go in little circles. You go like that, it's really not going to do a lot. Same thing with the teeth. And so just getting a small brush head, I always suggest looking at Costco or Sam's Club or Amazon and getting a deal. Especially this time of year, you'll often find Black Friday, Cyber Monday, you know, holiday deals on toothbrushes. Sam's and Costco tend to have the best variety of high quality toothbrushes.
Okay.
So yeah, that's where I would start.
Great. That's great advice. Okay, so can we talk real quick? This is the natural age of weaning. I wanted to ask you your opinion on this, right? Because we're talking about breastfeeding and that it is protective for a lot of things, but it can be protective for oral health as well. What is your opinion on the natural age of weaning, and do you take a stance on you know, when there should be a cutoff for weaning, and how does that relate to the development of the jaw?
Sure. I don't really subscribe to a very strict cutoff date for breastfeeding because I think that's a very personal choice. I do follow the World Health Organization guidelines. The greatest benefit is from 0 to 1. 1 to 2, I think there's a really great bond that occurs during that time.
Mm-hmm.
The health benefits are slightly less than that first year of life. But, after 2 is when I, you know, I don't personally recommend doing that. Do I think it's bad to do it? No, but we've seen a lot of studies with prolonged breastfeeding and increased risk of cavities. And so that's
Mm-hmm.
where my recommendation usually is usually weaning by age 2 is a good idea.
Okay.
If people want to continue, that's absolutely their right. And if the child wants that, then that's wonderful. But my concern is more from an oral health perspective,
Mm-hmm.
of ensuring that it's done responsibly. As long as the brushing and flossing occurs and that use of fluoride is beneficial, and used, then, I don't really discourage breastfeeding in any time.
Mm-hmm.
So I guess my answer would be, as long as the child and the parent want to continue that relationship, I think it's fine.
Mm-hmm.
But as long as it's responsibly managed. I have had patients that continue to breastfeed, at 3, 4, and 5, and that's their prerogative. But I've also seen and read more about children like that having more cavities. And I think the risk isn't from the breast milk, it's more from the habits, because they're also incorporating other sugars and things into their diets. And if we're not brushing and flossing regularly, then all of that is going to be used as substrate for bacteria to cause cavities.
Mm-hmm.
I would say my personal cutoff would probably be 2, just because the World Health Organization states their benefits up until that age.
Mm-hmm.
But every parent is doing what they think is best for their child. It's not
Mm-hmm.
my place to judge what they're doing.
Right.
I've tried to be as supportive as I can, but give them the tools to ensure that their child's oral health is not affected as a result.
Okay. Yeah.
There are studies, orthodontic studies, that show that breastfeeding actually decreases the risk of crossbites and things like that, and it actually helps expand the palate naturally, instead of bottle. And so I think that's awesome. If you can avoid
Mm-hmm.
potential issues with
Mm-hmm.
braces and things like that as a
Mm-hmm.
result, go for it.
Yeah. Yeah. I have read similar studies as well. So I'm glad that you are on board with that as well. So let's talk about fluoride though, because there is a lot of information out there on fluoride, and some of it is good information and some of it is not good information. So let's hear your take on fluoride.
Sure. Yeah, and I agree. There's a lot of misinformation. There's a lot of fear regarding fluoridation, in particular community water fluoridation. Um, and there's a few ways that fluoride is beneficial. The first way is it's incorporated into the teeth from birth onwards. And what happens is bones and teeth are made out of hydroxyapatite, which is a really strong material.
Mm-hmm.
What happens with fluoride that's ingested is during that age of 0 to 6, as the teeth are forming, the adult teeth included, it's incorporated into the enamel matrix and it becomes fluoroapatite, which is a
Mm-hmm.
lot more resistant, and it also prevents against cavities in the future. Once the teeth come in, and we use fluoride toothpaste, that's a topical application. So, when there's food on the teeth, fluoride, if you rinse with it, will often penetrate through the plaque to the tooth to be protective. It also will change the activity of bacteria to prevent it from creating a cavity. So we're looking at topical fluoride and systemic fluoride. The benefits of systemic fluoride decrease considerably once the teeth are formed, but there's still that constant sipping that we do of water, and that topical effect of that fluoride is still effective at prevention of cavities. A lot of the misinformation is out of fear, I believe. People say that it's linked to thyroid disorders and ADHD and autism and things like that. But I follow evidence-based dentistry and evidence-based guidelines. The CDC, the World Health Organization, the American Dental Association, the American Medical Association, there's over 100 national organizations that have committed to saying that fluoride is good and beneficial when used appropriately. So our community water fluoridation is generally around 0.7 parts per million, which is 0.7 milligrams per liter of water. It's controlled to ensure that it's used at the appropriate amount and that it doesn't cause systemic issues. Now, in other parts of the world where it's not controlled, like where my parents grew up in India and certain parts of China, natural levels of fluoride are incredibly high. We're talking about 10 parts per million instead of 0.7. In those areas, you do see systemic effects, and that's why they remove fluoride from the water, or they don't ingest that water at all. And so in those areas of the world where it's naturally occurring at high rates, they do see issues. But at 0.7 parts per million, it's been shown over the last 70 years from various studies that there's no systemic effect of it. The concern I have for little babies is that formula actually includes fluoride in it, and it's how it's made. And so I always recommend, if you are formula feeding your baby, to use baby water from, the water aisle to mix the formula with, so that they're not ingesting too much. Up to 1.2 parts per million has been shown to be not an issue. The only dental issue that we see from too much fluoride is called dental fluorosis. All that does is it creates little spots on the teeth that mostly only dentists would see, but it also does make the teeth less resistant or more resistant to cavities. So dental fluorosis does exist. I'd say less than 2% of the world has extreme dental fluorosis, where you would see pitting and brown teeth. About 1 in 4 of us have evidence of dental fluorosis, and it's not a problem. My husband has it. No one will know. We look at our teeth a little bit more, closely than the average person. But dental fluorosis is really the only concern that we have when people have too much fluoride. But for those reasons, our organizations have changed what's recommended for fluoride use over the last 20 and 30 years. And that includes, knowing now that chicken nuggets have fluoride in them, and black tea has fluoride in it. And there's other ways that you can get fluoride, and that's why less and less likely to prescribe fluoride supplements and things like that, because we get fluoride from other things. So it's really important, I think, to establish with the dentist early on to ensure that your child isn't getting too much, or they're getting the appropriate amount, they're using the appropriate toothpaste or mouth rinses, and not overdoing it. And so that's why at my office we do under 3 for free exams to ensure that parents have access to care and the ability to get information, the right information, to ensure they're doing the best for their child systemically, but also topically with fluoride.
Yeah, that's wonderful that you do that, because the education right there is key. And that way parents have the opportunity to ask all those questions and dispel their fears, and then be able to move forward in a responsible and healthy way for their children. So,
and there's some people that decide that, they don't want to use it, and that's absolutely okay. If that's something that they believe strongly in, I never force anybody or dismiss someone from my office for having beliefs that are different than my own. But it's my job to educate them and address those fears and concerns. And I'd say 70% of the patients that come in fearful of fluoride leave empowered and educated about it and can make their decisions based off of that. Now, for the families who don't use fluoride, I always recommend that the children's teeth are pristine, that you don't have any, plaque or bacteria left on those teeth at night. And if that's the case, if they can keep the teeth clean and floss and brush regularly with their non-fluoridated toothpaste, and we don't see plaque at their recall visits, then by all means, don't use it. But my concern when we start to see early or incipient cavities on children that aren't using it, I always tell them my first recommendation, if we ever see that, is the use of fluoride. And so I think it's a good way of meeting halfway.
Absolutely. So let me ask you another question about the types of bacteria in the mouth. So it's my understanding that there are different types of bacteria, and one type causes gum disease and the other type causes dental cavities, and that the more predominant bacteria that you have in your mouth will, you know, manifest as either gum disease or cavities. What's your opinion on that? Is that true or close to the truth, or where do you fall on that?
Yeah, so in pediatric populations, we don't see that much gum disease, but the cavity producing bacteria is called strep mutans. And everybody's natural levels of strep mutans vary. Unfortunately, kids mostly get it from their mothers. We pass on the bacteria that causes cavities. So by sharing spoons and cups and things like that at an early age, we can increase our child's risk for cavities. So what I always recommend is be a good example for your child. Make sure that you're cavity free and don't have gum disease, because we do pass those on to our children. And by being a high risk patient yourself, you're putting your child at risk as well. So as far as cavity is concerned, you know, controlling that, you know, is something that we really want to do, and that's just brushing. Now with gum disease, there's 3 main bacteria that cause it, and I'm not going to get into the microbiology of it. That does vary from person to person as well, but it also depends on, you know, habits. So smokers tend to have higher levels of particular bacteria than non-smokers, and those habits dry the mouth out. You know, medications. So elderly folks that take a lot of medication, or even younger people that take a lot of medication, are going to have a dry mouth, which leads to certain bacteria taking over. And so those bacterial controls are really important, and making sure that we limit the bad bacteria and encourage the good bacteria. As any other part of the body, that's what you want to do. And so by creating those healthy habits of brushing and flossing as a child, that obviously translate into adulthood too. A lot of our 20-year-olds don't visit the dentist because their parents aren't making their appointments for them. And that's when we see a lot of the increase in gum disease, is when they stop going to the visits regularly. And what happens is the bacteria gets stuck underneath the gums. It calcifies into tartar or globulus. And when it's not removed, it continues to create that problem. And then that will start eating away at the gum attachment for the gum to the bone to the tooth, and it'll cause what's called pockets. And those pockets are pockets of bacteria. As that bacteria continues to replicate, it will eat away at the bone that's surrounding the tooth. So that's why you often see people in their 30s with early gum disease, or people in their 40s who have lost teeth not related to cavities, is because of that lack of dental care. So that's why that every 6-month recall is really important. By removing all the buildup and plaque and bacteria, you're creating a healthy environment and limiting that bacteria from replicating and causing those problems.
Gotcha. Okay. Very good. So let's talk about food, like the cariogenic foods that as moms, we want to make sure that we limit with our children in order to promote the cavities.
Absolutely. So I like to talk to patients about what we can control and what we can't control. So what we can't control is if the teeth have deep grooves, or they're tight, or the teeth are crowded and they have difficulty with brushing. We can't control what's in our saliva. Some people have the propensity to have more mineral content in their saliva, and some don't. Some have less saliva and some have more. I mean, you can see even between your own children, one drooled more than the other, right? And has more protective saliva over another one. So those are all things that we can't control. That's just genetic predisposition. What we can control is frequency of snacks. The more frequent we are eating, frequently that we're eating, the less chance our mouth has to recover. So we talk about pH and balance. What we like is a nice neutral environment that's going to have the least propensity for bacteria to replicate. And then as far as frequency, you talk about the neutral pH. Now you eat something, it's going to go down because your saliva is breaking down all those acids and byproducts and everything. Now you eat again, 30 minutes later, it's going to dip down. 30 minutes later, it's going to dip down. So that's why we say you sip all day, you get decay. We see with kids who drink a lot of soda, sports drinks, flavored milk, sugary drinks, higher cavity risk. And that's not necessarily because of what they're drinking, it's more about frequency. Now, down at a mealtime and you have a cup of juice, that's very different than if you sip on it all day long because your mouth isn't getting a break.
Mhm.
Did I lose you? I'm sorry. Hold on. Sorry, my computer did something funny. And so the other thing we try to stay away from is sticky foods. And that can include dry fruit and natural things that we assume are healthy. But anything that gets stuck in a groove of the tooth for a long period of time is going to lead to a cavity. So things like bananas can be very sticky, dates can be very sticky. It's natural sugar, but it's still sugar at the end of the day. Starchy foods, I always talk about goldfish teeth at our practice because you can often see goldfish and Cheez-Its and the orange that gets around the gum line. And I always talk about the goldfish crackers and when they were last eaten. Oftentimes it's a few days ago.
Wow.
And so unless they're brushed off regularly, those are going to cause cavities. It's carbohydrates and they cause cavities. The other innocuous one that people don't think about is the gummy vitamins.
Mhm.
They get stuck in the teeth, and a lot of people say, oh, well, they have it first thing in the morning, they go to school, and then I ask them when they floss, and it's not often, but it's usually at nighttime. So when you think about if you ate a gummy bear that morning, and then you left it in your teeth all day, and then you don't brush until, night, that's 12 hours that the little gummy bear has been sitting between those teeth.
Mhm.
So I always recommend if you're gonna use a gummy vitamin, eat it at night. That way you can brush and floss directly afterwards. My ideal type of vitamin is a chewable, like the chalky Flintstones that I grew up on.
Mhm.
Or if you eat a vitamin, don't eat a vitamin at all. Just eat a balanced diet, which for picky kids, that's not even, it's not necessarily a
Yeah.
possibility. But those are the main things that I try to get parents to understand is it's the frequency, added sugars here in the United States. Sugar is in everything. It's in our yogurt, it's in cereals, it's in everything. And so we try to stick to non-carcinogenic foods as much as possible. Even things like 100% fruit juice. I get this a lot with parents saying, well, it's organic, it's 100% natural. All 100% natural juice is going to have is 100% natural sugars, which is going to cause 100% natural cavity. And so if you can stay away from juice, the new guidelines are rarely under 5 years of age should a child have juice, which sounds crazy to a lot of people. But I mean, my son's never had juice and he's 2.5 now. It's not impossible. It's just a choice you have to make as a parent. It's added calories. It's creating a bad habit as we get older. I know a lot of adults are really, addicted to what is that, dry and like the energy drinks and all of that. All of it's sugar. And so I want to try to get them to make those habits early for drinking regular water throughout the day, so that you have the habit as you get older and that taste for sugary things. Taste are usually created by age 2 or 3, and so if you can limit the added sugars until that age, you're creating a lifetime of good and healthy choices. And so the diet is so important, even that first couple years of life. And a lot of people like to reward their children with sweet things, and I don't encourage that. It's creating a bad habit of when you do something good, you get something sweet, and you don't really enjoy that as far as the dentist is concerned.
Mhm. Yeah, absolutely. So when it comes to non-carcinogenic foods, foods that don't cause cavities, what types of foods do we want to be putting on our children's plate on a daily basis then?
Well, obviously, fruits and vegetables are plentiful, and that's what we should really fill most of the plate up with.
Mhm.
Dairy and eggs are very good for the teeth. Meat is fine. Grains are good too, like whole grains, oatmeal, whole grain toast. Um, I always recommend dips like hummus and
Mm.
cheese and things like that. Anything that doesn't have added sugar in it. The best for leftovers, homemade leftovers that you can put on a plate and warm up. I mean, that's probably the best thing. Foods are best for our children. Things out of packages are easy, but they're not necessarily the best for us. They have a lot of preservative sugars to keep them fresh. I try to avoid that. Nuts, almonds, pistachios, walnuts are always a great idea.
Okay.
Thirdly, the pouches, if possible. It's a very passive way of eating, and so we see some muscular tone issues with children and so I was we're going to use a pouch for littles to put it on a spoon and feed them with a spoon. Also, chance correctly and is used in a appropriate way rather than that passive,
Yes. Okay. Mm-hmm.
Something that I'm seeing more of. A lot of parents are concerned about schooling, or we often ask about what is their history of eating pouches when they live.
Oh.
That's something that caution our parents on when they're really little and making sure that they're being overall musculature to be able to.
Mm-hmm. Mm-hmm. Yeah, I hadn't thought about that, the pouches, but you make perfect sense. Absolutely. So put it on a spoon and then have them eat it that way. That seems like the best.
Yeah, it helps with oral motor function.
Mm-hmm.
And also the spoon too. I think it's a lot more effective for them. And yeah, those pouches can be healthy, but again, you have to look at that added sugar content.
Right.
Apple juices and grape juices to sweeten, which is at
Mm-hmm.
the end of the day added sugar.
Mm-hmm.
We see a lot of overweight children. I think it's over 34% now of our country and of children 0 to 18 are obese, not even
Yes.
weight.
Mm-hmm.
Creating those habits and getting them used to fruits and vegetables and whole grains is really important at our age. And we have our kids eat that, and we're all adults. The other thing I see a lot of is soda and sports drinks. A lot of pro athletes use Gatorade and all those sports drinks to help hydrate and balance their electrolytes. The average doesn't need that. So during sports, I recommend just plain water.
Mm-hmm.
Just most of our kids aren't pro athletes.
Mm-hmm.
And you're not bathing the teeth again over a 3-hour practice.
Right.
30 sugar, and that's it. So we okay. Same thing.
Yes. The sodas.
Yeah, and our kids 8 to 12, we see a lot of that. You see
Mm-hmm.
a result because they tend to hold the liquid in their mouth for a little while, especially if they're on the sidelines like watching the game. They tend to swish it around a little bit, and then it's even so.
Okay. Very good advice. All right. Last and final question. You ready? I want to know your top 5 tips for moms to give their kids the best oral health they can.
I'd say starting dental care early is probably the best tip you can get. That way, somebody is monitoring the teeth and the development and diet and hygiene and everything for you to make sure that everything is good. So even starting when they only have 1 or 2 teeth, I always say by their first birthday so that we can make sure that they stay cavity free until they're age 3 and beyond. Prevention is probably the biggest thing that we can do at that age. And even, injury prevention is something we review too, and trauma prevention, what to do in case of trauma. That way you're prepared if something could happen. The second tip would be just make brushing and flossing fun, whether that's allowing your child to pick their own toothbrush or find a flavor of toothpaste that everybody likes. I always make a recommendation of when they're older, use disposable tablets. Disposable tablets can just be bought on Amazon, and you just chew them up, and it shows you where all the plaque is.
Yeah, we have this.
Back, but people don't use it as much now. But use it as a family and do it on Sunday and see where everyone's missing.
That's a good idea.
I think as adults, we kind of aimlessly brush our teeth thinking about a million other things. I used those tablets and I realized I was missing one of my teeth for a really long time. Dentist, so I'm tooth obsessed. So we can all improve our oral health, and I think by leading by example and making it fun, definitely good habits. I guess the third thing would be getting rid of the bottle at bedtime. That's
Mhm.
the main reason we see early childhood cavities is because of that. You'd be surprised at how many people put mountain cream and, stuff in the bottle just to get their kids to be happy. And happy doesn't really mean healthy. And so getting rid of that bottle early, especially at night, and encouraging those habits early is what's going to help prevent cavities for kids as early as
Mhm.
keeping an eye on sugar content is a really important factor of staying cavity free. So that would be my tip is look at what's in the juice, look at what's in the sticky candies, limit the dried fruit, yogurts, and then natural juices and things like that. Really look at the new guidelines that came out about what a lot of kids are drinking flavored milk, chocolate, strawberry, and there's so much sugar in their diets now that if you keep an eye on how much sugar is in the stuff that we eat, it's way above the international guidelines and what's
Yeah.
approved.
Mhm.
4 to 6 teaspoons a day for an adult is what's recommended at most. And I'd say in one soda, you've got more than that.
Yeah.
So just keeping an eye on that early is a good idea. But I guess the biggest tip would be setting a good example, making sure you're taking care of yourself so that your child knows that that's important. And then, by you staying cavity free, you decrease the risk of your child having cavities. So I think
Mhm.
that's really tough.
Awesome. You're fabulous. Thank you so much.
Nice, anytime. I'm glad to help.
And so tell us where we can find you, the Healthy Mom University community, if they want to schedule an appointment. Where can they find you?
Sure. You can go to our website. It's vierapd.com, or you can follow us on Facebook or Instagram for tips and tricks and fun stuff too for your kids. You can call our office at 321-417-0107, and our staff would be happy to walk you through how to get an appointment. And if you have any particular questions, they're educated on how to answer them. So we'd be happy to see you and take care of your kiddos and make sure that they stay cavity free for life.
Awesome. Thank you. And real quick, I didn't mention, but talk a little bit. Now, tongue tie could be a whole other interview in itself, and we can hopefully do that in the future.
Yeah.
But talk a little bit about what you do in your office for tongue tie.
Sure. So tongue ties and lip ties are something that have really skyrocketed in the last 20 years. They've existed since the start of time, but we've seen that in some kids, a release of a tongue tie or lip tie can help improve breastfeeding and the breastfeeding journey for mom and baby. So it's something that I'm very cautious about. In order to be seen at our office for that type of procedure, you have to be referred by a lactation consultant or a psychologist or a pediatrician who has verified that there is a concern with the tongue tie or lip tie in either breastfeeding or speech. And so we use a CO2 laser, the light scalpel laser, and it's a very non-invasive invasive procedure. And so that's what I've committed to do in my office. And we see breastfeeding moms and kids with speech delays and things like that. And we evaluate them here. And if I think it's something that would help them, we go ahead and do the procedure in office. Depending on the child's age, we'll either do it same day or we will reschedule for another time. But we have a nursing room for our moms so that once a procedure is done, they can sit and take their time and really try again and see how it's going. But we work really closely with our lactation consultants in the county to ensure that we're providing a service that's necessary. The last thing I'd want to do is do a surgery on a child that doesn't need it.
Mm-hmm.
So we're very cautious with how we do it and when we do it, but it is a service we provide here